Cancer staging tells us how severe the cancer is. In this video, let us try to understand what is cancer staging, how it is done, what are the different stages of cancer and why it is important. Hello friends, I am Dr. Aravind. This is the sixth video of the cancer awareness series. So once the diagnosis is done, as we have seen in this previous videos how the diagnosis is done, the next thing which comes into play is the staging of the cancer. So what is cancer staging? Cancer staging means it tells how severe or how advanced the cancer is, whether it is just localized to the same area of the cancer or whether it has spread to the nearby lymph nodes or whether it has spread to the different organs. So this is what is cancer staging all about. So why it is important? Because based on the staging of the cancer, the treatment is decided. So whether the treatment is chemotherapy or it is radiotherapy or it is surgery or chemotherapy and radiotherapy before surgery or surgery followed by chemotherapy and radiotherapy or surgery, chemotherapy, radiotherapy, surgery and again chemotherapy, radiotherapy or palliative, whatever the thing it is decided based on the staging of the cancer. And apart from that also it helps us in prognosticating the patient. So why it is important? Because like in stage 1 cancer, if the patient comes, we can tell them it is curable, you will be completely cured. So in stage 4 cancer with distant metastasis with spread to distant organs, we can tell the patient that cancer is not going to be cured completely. And in stage 3 cancers, for example, sometimes the cancer might be completely cured, but the chances of recurrence of the cancer is high. So that is what we have to tell the patient. So it helps in the prognosis of the patient. So apart from that, how the staging of the cancer is done, it is majorly done in the three ways. First one is clinical. Clinical means, suppose if we go to the doctor and without any investigation so far, he might examine you. For example, let us assume we have some oral cancer. He might examine you, he might see like how big the cancer is. It is 2 centimeter or 4 centimeter or 5 centimeter or 10 centimeter. So apart from that, he will examine the draining lymph nodes, especially these neck lymph nodes for the oral cancer, which is level 1 to level 6, and they will try to find if there is any enlarged lymph nodes. Sometimes they might be able to find, sometimes it might get missed. So that's why clinical staging is not so significant. Apart from that, clinical staging is also done through surgical way. Surgical staging is also called is a kind of clinical staging only. Suppose in some cancers, let us assume in stomach cancer, we might not find the metastatic deposits in the radiological investigations like CT, MRI or PET CT. Then we do a diagnostic laparoscopy, then we find some metastatic tissues over that. So then we send the biopsy for that. So then you can tell what kind of staging it is. Like for suppose let us assume we are doing a cervical cancer or ovarian cancer, sometimes we might feel the nodes as enlarged and thickened or it is hard. So based on that we will give some staging which is the surgical staging. So the next one which comes is the radiological staging. Radiological staging means like with the help of CT, MRI and PET CT, using these diagnostic imaging modalities, we give a staging. But in sometimes in radiological report also you will find these lymph nodes are enlarged, probably of infective or inflammatory etiology or cancerous, so metastatic. So they will give /// so confirm with histopathological reports, confirm with biopsy reports. That's what they would have given. So even this also helps in staging, which is more accurate than the clinical sometimes. And but finally the pathological staging is only going to tell us whether it is cancer or not and what is the clear staging. So we might feel that this is a cancerous lymph node during the surgery and we might have excised and sent, but whatever the pathologist report says, like whether it is cancer or not, based on that only we can say what is the staging. And sometimes as I said, the lymph node, they might say infective or inflammatory or metastatic node, then we do a biopsy, then we try to find whether it is cancer or not. Based on that, staging is done. Okay, right? So then we come to the different stages of the cancer. So staging is basically done based on TNM staging. So T means tumor, N means nodes and M means metastasis. So tumor means like based on the size of the tumor, how big the tumor is, we give us staging. Even in T, there are multiple levels, which is T1, T2, T3 and T4. In nodes, whether the nodal metastasis, whether the nodes are cancers, whether cancer tissues are present in the nodes, or whether it is present in the draining nodes, or whether it is present in the distant lymph nodes. Based on that, we give scoring to the n, which is called 0, 1, 2, and 3. Metastasis is only 0 and 1, which is whether metastasis is present or not. Metastasis means cancer present in the distant organ other than the original organ of the cancer. For example, if there is a cervical cancer, but if there is lung metastasis, then it is M1. So in the similar way, if it is a oral cancer and if it has spread to distant organ, then it is metastasis, right? So stage 1 simply means it is a localized cancer. The cancer is just localized, is just present in the area where the cancer originally belongs to. It is not spread to the draining lymph nodes nor the distant organ. Stage 2 and 3, these are the locally advanced cancers with or without nodal spread, but definitely there is no distant organ metastasis. For example, if we have cervical cancer, whether it is split, the nearby organs are the urinary bladder and the rectum, front and behind, right? So whether it has spread to that or not, whether it has spread to the draining lymph nodes apart from the internal iliac lymph nodes, external iliac lymph nodes, whether it has spread to the some other lymph nodes or also. Based on this, we give the stage 2 and stage 3. Stage 4 is metastatic cancer or advanced cancer, whether it has spread to the distant organs like brain, lungs, liver. Based on this, it is the stage 4. Stage 4 is usually called as the, usually it is incurable, it is advanced stage. Usually most of the treatment directed towards this stage are palliative rather than curative. So that is also one more important thing. So what is metastasis? That itself is a very big topic. So stage 0 means precancerous stage or the carcinoma in situ. In previous videos we have seen, in the screening videos also, there are some signs in which you can diagnose cancer even before it comes. These are called as the precancerous lesions. For example, in oral cancer, leukoplakia or erythroplakia, which is the whitish patches or reddish patches in the oral cavity. These are precancerous lesions. These are not exactly cancer, but they have the potential to be converted into cancer. So if you cure at that stage, then it prevents cancer. For example, in breast, we can say ductal carcinoma in situ. In cervical cancer, carcinoma in situ is also there. All these things are precancerous lesions. These are completely curable, and this prevents cancer from occurring once it is cured. So I hope this video was useful for you. If you have any doubts, please do leave them in comments. I will see you in one another useful video like this. Until then, it's Dr. Aravind signing off. Om Shakti.